We have quite a full schedule today, actually, with multiple questions to be answered. And uh, so it is right at noon. So welcome to everyone, and we will get started. I'm sure a few others will join us as we proceed. But we will start with Janet uh, starting us with prayer. And then on our schedule is to do a quick report on teeth, whatever people have been doing with teeth and that with nerves and gum. I had two questions come in, carpal tunnel repair and then nausea during pregnancy. So we're going to spend a little bit of time on each of those. Valley's going to share an herb highlight whenever she joins us, so we'll watch for her.
May
And
I add a question? Menstrual cramps for young girls.
yeah, that actually has the same answer to nausea during pregnancy. So
I
we're
thought so.
with a little bit of addition on that.
Yes.
Okay, perfect. I've got that note, and actually, I'm probably going to add that into the other presentation at the tail end just so that we don't forget it. All right, Janet, we'll start with prayer then.
Okay. Our dear Heavenly Father, we're so thankful for all thy blessings to us. We're thankful for our health and strength, and we're thankful for our families and pray that I will bless them. Please help those that are presenting things in this meeting that they can do well and that we can understand more. And please bless that we can have a good day. In the name of Jesus Christ, amen.
Amen.
And thank you, Janet. And welcome to Deb and to Valley as you joined. Valley, you have an herb highlight, but you're welcome to wait until you have a more stable area. What do you want to do now or later?
Yeah, in about 10 minutes, I'm driving to where I'll have a stable place. Thank you, Fred.
Okay, we'll do it then. Um, and I was just making a note. Maybe we'll answer the menstrual cramps for young people and really anyone that needs that. I I don't know that we've been through this one before. I don't remember. Has anyone else had to solve it for themselves and remember what the foundation is? Because let's just go ahead and answer it right now since we've got the ability to answer that. What is, what's the underlying cause and how do you solve menstrual cramps?
I don't know the answers to those, but I know that, well, maybe solutions. I think isn't red raspberry leaf tea an excellent everything for women?
Yes, and that actually is the first foundational do for menstrual cramps. Because if we're getting enough red raspberry leaf tea, most of the time they don't need to do anything else.
What? Why? What is it about red raspberry leaf tea?
We tried to search for that the other day, actually, because it's interesting. Dr. Christopher and other herbalists, in fact, I was just looking in a book called Herbs to the Rescue uh, today, and it says red raspberry leaf tea for what we're going to talk about in the nausea during pregnancy area, all the way through for women. And Dr. Christopher, in Every Woman's Herbal, said girls, as soon as they're pre-menstrual, need to start drinking red raspberry leaf tea because it balances the hormones. And women, all the way through life, even after menstruation stops, need to keep drinking red raspberry leaf tea because it balances the female hormones and keeps things balanced and whole. So it has other properties, though, and let's talk about those for just a minute. Because the other thing that Dr. Christopher taught was red raspberry leaf tea is sufficient as the only thing that you take if you're not feeling well, a flu or something like that. It's antiviral and it balances the body's blood cleansing and things like that. So you go, God's design gave so many things in that red raspberry leaf tea, and I don't know how many of you have actually drank it during life, during pregnancy, those kinds of things. And then I'll tell a couple of stories from women that I know.
It's interesting that you said he said for was it upset stomachs? Because all of Faye's kids learned that red raspberry leaf tea helped that. And when they started feeling ill, they would run, grab the red raspberry leaf tea and drink it.
Mhm.
The other question I have is what is like about how much to water and how do you prepare it and about how much do you start with as a rule of thumb? I know we need to test spirit-led body discernment, but I was just curious if there's a basic thing to where to start.
Okay, first, how to make it. Same as with any other leaf tea. However you're going to make it, I prefer the French press because it's easier to just put in. Uh, for that quart size, I would say roughly 2 tablespoons, and then pour the hot water in, put the lid on a French press. If you're using a tea bag, it's obviously you put the tea bag in the cup, pour the hot water over, and then I cover the um, cup to keep it hot until you take the cover off 15 minutes later and strain it or take out the tea bag. How much for different women? Yes, use your own spirit-led body discernment testing to find out how much is needed. Typical, about a cup a day. For some women, that's a cup every 2 or 3 days, and for some other women, it's 2 or 3 cups a day, depending on where they're at in life. And we'll mention that again when we get to the pregnancy part.
So that was 2 tablespoons to a quart.
Yeah, roughly.
Okay.
Now, the other thing with menstrual cramps, and I've seen it work amazingly. First, let's talk about red raspberry leaf tea. I have seen people, my own daughters, stepdaughters, start drinking red raspberry leaf tea and say, oh, I don't have painful periods anymore. And for those few that continue to have some challenge, Vitex, also known as chaste tree berry, is amazing. And that is typically, you could make a tea with it, but most people just use a tincture. And maybe just as soon as you know the period is going to start, a dropper full or two of chaste tree berry. And again, just completely calms it down. Just and throughout the time of the period. Now, if that period is running too long, more red raspberry leaf tea.
Is Chase Treeberry or Vitex, are those Dr. Christopher or I don't understand what they are. Sorry.
It's just a plant. We actually had a chaste tree plant in our yard, and we made really close to a gallon of chaste tree berry extract using alcohol and just putting the berries in it 2 years ago. And so the chaste tree bush grows a little hard berry on it that I'm going to call it grayish green. And you dry those and then cover them with alcohol, and they calm the cramping and pain down. Women have told me that they had cramps so bad they couldn't do anything. They would just curl up in a ball and lay there for hours all the way through their period. And with chaste tree berry, and they were able to fully function without the pain. So,
Wow.
so That's the two that make the biggest difference. When I talk about pregnancy and nausea, we'll spend few minutes on a couple of other things that can help to finish balancing the hormones, but those two are the two that are the instant go-tos, and red raspberry leaf all the way through. Any other experiences on that? Because I realize I'm talking from the male gender, just what I've observed in multiple people as I've helped them.
Fred, maybe you'll want to mention that woman you mentioned a long time ago that took too much red raspberry. I can't remember what it did, but she was having problems. Remember that one?
Oh, yes, thank you. A lady in her 70s came to me because she was having all kinds of health problems and primarily digestive problems, and nothing was working right. And she'd actually created a allergy to pretty much all foods because red raspberry leaf, she was told by an herbalist many years ago, like 30, 40 years ago, that she needed to take red raspberry leaf. She was taking it in powder form in water and doing, I forget what they had started on, but she kept doing it daily, not 6 days on, 1 day off, and not 6 weeks on and a week off, and not 6 cycles on and a cycle off. She was doing it daily for like 40 years and in really high amounts. Red raspberry is astringent. It's tissue tightening or toning. Well, that's wonderful if you need it to take a little bit extra, but certainly not dry powder enough to make a gallon of tea every single day. And she had dried out her colon so bad that she'd caused some pretty significant health challenges because someone had told her she needed to take it, and she never retested that, if I can put it that way. And so when she got to me, I told her, stop the red raspberry. And she just would not, could not. She had it tied to her belief system that that was part of keeping her alive. And it took over a year of her suffering to finally stop taking red raspberry leaf because it dries out tissue. It restricts or tones or tightens tissue, which is wonderful in small amounts, a cup a day. And again, that's reemphasize 6 days on, 1 day off, 6 weeks on, a week off, 6 cycles on, a cycle off, because that is an herb. The only time I make an exception to that 6-in-1 rule is if you're fighting a very embedded fungal infection, and then you keep going through that off week to finish killing out the fungal infection. But that's not a building process at that point. That's a getting control of an overgrowth. So thank you, Valley, for that reminder so that people don't overdo it. That's why your spirit-led body discernment is so critical, that you test for yourself and find out what is right for you. Super powerful on that one. While we're talking about female, I'm going to just share the screen and talk through the nausea during pregnancy and a little bit of other female things. So that was a good starter for us on this, because now we've got a chance to look at things that can help all the way through pregnancy and childbirth and so forth.
Fred, can I interject one more fast thing since we're going on to childbirth and away from the cramps? And it's in those DVDs of Dr. Christopher's lectures. It's in a classroom setting. You'll remember that. But there's one time when somebody asked about it, and he said it was true that if we eat super, super clean, we won't even have a menstruation. I mean, nothing's going to come out. And I remember, not the exact details, but I think there's like a woman or two in that class who said, yeah, that happened to me. Isn't that interesting? Anyway, I'll drop that for now.
Oh, that's a super good point. And in the pregnancy one, I wanted to make that point too. We need to eat clean. The body needs clean, wholesome food. And the cramping and stuff really is the body saying, I need materials. I need the wholesome materials. So we're actually going to cover that a little bit more during the nausea during pregnancy. Things I will cover in this presentation. Red raspberry leaf throughout pregnancy. Here we go again on red raspberry leaf. Calcium tea, I'll have a few stories to talk about that. Microminerals, because we're using the microminerals to finish developing new cells in the body, the baby's body and our body, the woman's mother's body. Ginger tea and a few other teas for nausea. We'll cover those. And then I want to talk for a minute about checking for inherited causes, because if we've got something that's happening pregnancy after pregnancy, there's either an inherited cause or a nutritional cause that's pretty deep that we need to solve. And so maybe even doing the full troubleshooting process. So,
Could you clarify? He said if you eat clean, and two women said that happened to them. What would happen?
They didn't even have a period, like no blood. And I think Dr. Christopher, Fred probably remembers better, but I think he said that's the case because the blood coming out has something to do with the body cleaning out what doesn't belong. So I guess their bodies were so clean they didn't need it. I'd have to re-listen. Isn't that so interesting?
Yeah, it is.
yeah, and that is interesting. All right. Chime in if you've had other symptoms that aren't listed here. In fact, let me just do a quick chime in survey, unmute and speak up. What symptoms have you had during pregnancy that have made it uncomfortable or what you didn't think was going to be quite right? So I'm talking to a group that's never had any challenges during pregnancy.
Morning sickness all day long. When I was expecting my first child, we'd just gone to Manila in the Philippines, and I thought I had food poisoning. I was so sick.
Did that last for a long time or just a couple of days or?
It lasted for a long time.
So describe your morning sickness.
I would throw up or feel like I was going to throw up all day long.
Okay. So, and I've had women tell me nothing stays down, not even warm water.
Right. Micah had hyperemesis with all of her children.
Yeah. And I understand the woman that says, I never want to get pregnant again if you've went through that for month after month. I remember with my first wife, her first pregnancy, everything smelled bad. Everything. She didn't want to smell food of any kind. She didn't want to smell anything. She lost 18 pounds. Others, teeth are ruined, you know, and cavities are just rampant during pregnancy.
Yep.
Any other things you'd like to kick in while we're talking about this, please?
Brad, this is Leslie. I used to have a lot of depression. It would just be really deep depression that would hit me when I was preparing for my cycle or through my cycle.
Mm-hmm.
I felt like I only had about a good 2 weeks worth of feeling normal during the month.
Yeah, really good indicator that we're not getting enough nutrition.
Richard Schultz said no woman should ever give a birth. The childbirth should never happen while we're lying on our back. And I thought, I never heard that. And that's how it was done for me, but I didn't know different. So I thought I'd share that one.
Yeah, our medical community has not been trained on the natural positions for the most part. I appreciate the class I had on natural childbirth when I was 17 years old. and the help that it came from a midwife who'd done already hundreds, and I'm sure at this point, thousands of assisted births. Anyone else before we move on to what's the cause, what's the body looking for to calm that down, that morning sickness down, and actually get rid of it?
Sister, when I was pregnant, I felt fantastic because I usually felt terrible. And so being pregnant for me was like a dream. I could sleep well. I mean, other than getting up to the bathroom, but I felt awesome, and I was super peaceful. And it was just, I almost feel bad even saying things. My twin sister, it was like having a complete different personality. She was super irritable, couldn't sleep well. I mean, just everything was different. And it was just us feeling so bad for her. She was just never, and we couldn't really talk to her about it. It was just, she was super sensitive to stuff. It's almost like a personality change. It was terrible.
Hmm. Wow. So the first one, red raspberry leaf tea or capsules. And red raspberry leaf tea is super inexpensive. I grabbed just a screenshot of the three that came up when I searched for it, the first three, and less than $20 for an organic pound. Frontier, $15 through iHerb, Monterey Bay Herbs, $13.93, $14 for a pound. In today's market, I would look for organic. I would not buy non-organic because even raspberry leaves, red raspberry leaves, may be in an area where they're spraying. You do not want those sprays on.
Can you pick leaves off of your own red raspberry bushes?
100% yes.
Wow.
Dry your own and store it. And the helpful guidance on that is you're going to prune those bushes anyway. You're going to clean them up. Strip the leaves off as you prune. And you want to have the bottom branches cut anyway, so snip those branches off and strip the leaves off while you're pruning, and just save the red raspberry leaf while you're pruning and cleaning up. And you could get enough every single year if you've got 4 or 5 bushes to manage the whole family. A story or two on this. And I'm going to jump before pregnancy because that's when I've seen other success stories. Going back, I was working with several women. For some reason, my Air Force career, I was always with women all the way around me. Maybe one other man and in an office full of women. And in one office, there were 2 women who were complaining that they just could not get pregnant. And from that class, when I had 17 years old, I just suggested that they start drinking red raspberry leaf tea, make sure their diet was nutritious, and take microminerals, which we'll talk about in just a moment. And within just a few months, the one that had the most trouble getting pregnant came in and said, "Guess what? I'm pregnant." And that's the other benefit of red raspberry leaf tea. It doesn't just benefit to calm down morning sickness, but it also prepares the body for pregnancy with a clean diet and making sure that we're getting the other things that are needed. Calcium tea throughout pregnancy. Symptoms of not having enough calcium in the body: nausea, leg cramps, teeth, degrading teeth challenges, blood clots, and achy body, and morning sickness. And let me tell you a story of a woman that came to me during 2 pregnancies in a row, about 2 years apart. The first one, she was having really severe leg cramps and just did not feel well at all. And this was her third child, if I remember right. And she'd had problem with nausea and morning sickness with every pregnancy, but this time it was so much worse. And she was just in bed really throughout most of the pregnancy. And she says, "What can I do?" She actually talked to Winona first because she was in our neighborhood, and of course Winona's had 10 children and has a foundation of master herbalist and has read through Dr. Christopher's stuff like I have. And so she suggested that she just start drinking calcium tea all the way through the pregnancy. And it took a couple of adjustments. She says, "I'm still not getting full relief. How much are you drinking?" "I'm drinking a cup a day." "Well, make that 3 or 4 cups a day. Get enough in there." Because what's happening here? We're developing a whole other body, and calcium is the primary ingredient of bones, teeth, cartilage, and nerve sheath, and several other pieces in the body. And imagine how much is going to be needed with all those bones, all that cartilage, all the nerves that are developing. And so we can't steal that much calcium from an already depleted body of the mother. And as soon as she was drinking enough calcium, the rest of the pregnancy went totally smooth. And she was just so grateful to have a smooth pregnancy. She had the child at home with a midwife, and it went completely smooth. Well, fast forward 2 years, and she calls me and she says, "My midwife says I can't have this baby at home because I've got blood clots in my legs, and I've got horrible varicose veins, and I've got leg cramps again. And it would be too high of a risk for the midwife to have that baby at home in case a blood clot moves or anything like that." And I asked her, "How much calcium tea are you drinking?" And I think she must have forgotten in between that 2 years because she really wasn't drinking any calcium tea at all. And it really made a difference to start drinking calcium tea, of course, raspberry tea, and just getting the right materials in. But she needed a few other things to get everything in. And that's why I'm going to go to the next page here. So I'm going to suggest calcium tea, but if calcium tea can't meet the need or just doesn't work for that individual, Dr. Christopher's calcium formula may help. Take it as capsules if they can stay down. Anything is going to make a difference. It really is helpful to prepare for pregnancy before pregnancy. Getting enough red raspberry leaf tea in, enough calcium tea in, enough microminerals, which we're going to talk about in a moment, with a whole diet. Then we don't have to fight to try and recover because nothing stays down during pregnancy. And mom's body will sacrifice to make sure that that baby has enough to develop. But that's not even possible if there's not enough materials. So microminerals, every new cell needs microminerals. And if our reserves are sufficient, we've got full energy and we have full wellness. But if the reserves are low, it robs from the healthy cells of mom's body, and the body signals that more is needed, and we result with tiredness, nausea, just feeling horrible. And I've got the body temple function sheet showing here because at the bottom right-hand corner, you might remember that there's a list of plants that are high in microminerals. Let's not forget we're still eating a whole, fresh diet before pregnancy and during pregnancy. But alfalfa, kelp, nettle, watercress, sea salt, just test for what is best for the individual, and then encourage enough of those to meet the micromineral needs. And the acid alkaline needs, I didn't include a slide on that one, but remember that acid alkaline balance is another critical piece of that, with apple cider vinegar and molasses to meet those needs. And that is a critical piece for many of the women I've worked with, is just to get those microminerals coming in. That's not just during pregnancy either. That's the rest of life for all of us. In addition to ginger tea for nausea, and ginger tea works for nausea of all kinds, and you're familiar with that: airplane sickness, car sickness, motion sickness of any kind. But the other ones that help, and it might be unique to an individual: peppermint tea, catnip tea, take slippery elm to calm inflamed or upset tissues, and those can each be tested for individually. Now, if this is a second pregnancy, same symptoms, I would suggest going through the entire troubleshooting process and checking to see if there's spiritual, mental, emotional causes, as well as the physical ones that we talked about, or if they have blocks to pregnancy of their own or inherited blocks to pregnancy. I have found that way more often than I'd like to admit, is that because pregnancy had been so hard for ancestors, there was something dropped into the DNA, and it wasn't the mom's own challenge, it was an inherited challenge. And once the inherited challenge had been cleared out, a lot of the nausea, a lot of the morning sickness, those kinds of symptoms disappeared because they weren't truly nutritional completely. They actually were what I call settings from an inherited challenge. So it's worth just recognizing that there might be an inherited issue and going through the troubleshooting process and finding that. I'm going to mention very briefly balancing the hormones, male and female. This is true for before pregnancy, trying to get pregnant, and after. Dr. Christopher's hormonal changes is for both men and women, and then women, female reproductive formula, men, male urinary tract formula, and then a quote from Dr. Christopher that says, whenever malfunction shows in either woman or man in the reproductive areas, it's good to use the two formulas together. In other words, take the female reproductive and the hormonal changes for women, and Dr. Christopher's male urinary tract and hormonal changes for men. Thank goodness we have spirit-led body discernment to find out what is needed. And then you'll notice that I've put red raspberry leaf right in the middle of this because it might be needed or should be taken with women. I put the capsule format, but I would suggest tea is more absorbable than capsules.
Dr. Christopher doesn't sell red raspberry leaf tea.
You won't find it from Dr. Christopher's Herbs, but the company that I bought through forever carried it as bulk. And that's the same one that carried Dr. Christopher's Herbs. The wholesaler carried red raspberry leaf bulk. So, but
Which one was that?
it's the Holistic Botanicals
Okay.
wholesaler. Yeah. Now, a little bit of side, I guess, for someone that's pregnant, they ought to at least know this. If miscarriage is threatening, we ought to keep false unicorn and lobelia on hand. Make sure we're drinking red raspberry leaf tea. And miscarriage, what was the other one that someone presented just last week or the week before that would help with miscarriage? Now I don't remember. So, anybody else remember?
Is it cramp bark?
That's the one that was coming to my mind too. So if you and I are both remembering that, it's got to be.
And blue cohosh, did you say that one?
blue cohosh. Okay. Sounds like you're opening your computer and have both on there, Valley. Okay. Healthy pregnancy. Red raspberry leaf tea, herbal calcium, a wholesome diet, not a standard American diet, moderate exercise, gratitude and loving thoughts, plenty of calcium. Easing labor and delivery. The last 6 weeks, if we've been taking the red raspberry leaf all the way through, then you've got a birth prep formula that has just a few herbs in there to prep the body for the delivery process, including blue cohosh. And when Winona used either this or just plain blue cohosh, it was just a couple of hours of labor. When she didn't, out of her 10 children, I think she said she used it with 6, and those were all really, really easy labors. The other 4 were day and a half, 2 days, just horrible long labors because they weren't prepped for. So the birth prep formula is worth having on hand for the last 6 weeks. It is very specific on how to take it. 1 capsule a day for the first week, and then 2 capsules is typical, but use spirit-led body discernment to find out exactly what's right for an individual.
Is this a Dr. Christopher's product?
Yes, Dr. Christopher's birth prep.
Thank
It
you.
used to be called 6-week formula. You might see it referred to as the birth prep or 6-week formula to make birth easier. Now, occasionally during delivery, there's extra hemorrhaging. It is worth having shepherd's purse tincture on hand along with yarrow and cayenne for excess hemorrhaging. And herbal calcium helps with the after pains after birth, and so does red raspberry. Here we are again with red raspberry. It's just so broad-based. Now, I want to mention the few things that came out of a summary of this book, the Herbs to the Rescue book, and it's on pages 62 through 64. He emphasized again, and this is Kurt King, master herbalist, that wrote that one, and it's really a emergency herbs, how to do it out in the wild type focus for the most part, but he had some really good points in here. Some of these I've already mentioned. I'm just going to read through it again really quick. And it is 2 whole pages, and I've just taken a quick summary of it. Before and during pregnancy, red raspberry leaf tea with equal parts of nettle and horsetail grass, like our in calcium tea. And you can add mint or chamomile to improve the flavor and help with the nausea. Birth prep formula, or just blue cohosh, which is also in there. The last 6 weeks before delivery prepares the body for easy delivery. And make sure and use spirit-led body discernment to not overdo the birth prep formula or the blue cohosh, because you can take too much of that and create early labor. During delivery, as I mentioned in the last one, have shepherd's purse, tea or tincture available, and the horsetail grass tea or calcium tea on hand to help with the hemorrhaging. Yarrow tea to prevent hemorrhaging or for the postpartum infection challenges. And I mentioned it before, cayenne tincture or shepherd's purse to stop the bleeding. Yarrow will also stop bleeding. So a couple of little prep things there that are worth knowing and making sure that we don't get caught without those critical ones. We've already talked about the menstrual cramps, so we can jump out of this one and stop there. Valley, are you in a place you'd like? Go ahead, Debbie.
I think it's interesting that traditional Western medicine, as soon as you're expecting, they tell you to increase your drinking of milk, which then decreases your available calcium.
Yes. Yep. The advertising on milk has been quite broad, hasn't it? All
Can I
right.
make a comment about that real quick?
Go ahead.
On my first child, I I was married to a dairy farmer, so we pretty much lived on milk. And then I was taking calcium, pills. And when he was born, then my placenta came off before he was born, and I really bled a lot and stuff. But there was calcium deposits on the placenta. So anyway, just thought I'd throw that in.
Yeah, and those calcium deposits were inorganic calcium that couldn't be used by the body because the body had spent it with trying to balance the acid and alkaline. Yeah, the dairy industry advertising to try and plus up their dollars and not realizing the damage they're doing because uh, if we had our own goats or sheep, we wouldn't be drinking cow dairy at all. A cow is so hard to maintain at a family level, typically. Thank you each. Looking forward to next week, always. And we'll see you then.
Love y'all.
Yeah,
Thank you.
you.
Thank you.
Thanks.
Thanks. Bye-bye.
Bye.